My name is Sade and I suffer from sickle cell anemia. I believe I became fully aware of what it meant to be a sickle celler or a sickler, maybe around about the age of 7 or 8 years old. And like I said, I watched my brother growing up with the condition as well. And my mother being a nurse, we all knew that, yeah, my brother suffered from this condition. Growing up, I now understand from hindsight that the society in which I grew up with, those who knew about sickle cell always associated it with bone pain, whereas I hardly had bone pains at the time, and I had what they call a hemolytic crisis, which is basically your blood count dropping extremely low. So what that, the effect that had on me was I was extremely tired, extremely exhausted, couldn't do much. And my parents, obviously, because they were used to my older brother having bone pain crisis, they didn't really understand what I was going through. Because if I just tell them, I'm tired, all they say is, okay, go and take a rest. But that was about where it stopped. They didn't go further because they didn't understand either. What should have been done is basically the same for all sickle cell sufferers, in that you encourage lots of fluid intake, you encourage lots of rest, and for my type, basically it was just a lot of bed rest. But after a day or two in bed, I start getting things like, aren't you feeling stronger now? Do you mind going to do X, Y, Z? But if I keep saying I can't do that, they think, oh, she's just been lazy. What makes me happy is my family. I have a lovely son and I have a lovely husband as well, so they make me happy. Yes, they are my carers in every sense of the word. They do everything from meal preparations to bringing me medicine when I'm ill, rubbing my legs if I have pains in them, and they do a fantastic job of it. The message I would like to get out there concerning sickle cell sufferers, they're varied in a sense. I would like to say to people who know of the condition not to be afraid of it. And for other people who are not aware, I'd like them to get some awareness so that they understand what things we go through. Because sometimes when I go to work, I'm well within myself, but I might have an isolated joint pain, most especially on my ankles or my feet. And that means I can't walk the short distance between the train station and my office. And I have to catch a cab for that short distance. So I would like people to understand that sometimes we don't have it easy and we're not making things up when we say we don't feel well, because that is the general tendency, because people can't see that if you're not ill all the way, you're only just a little bit ill, but they don't understand what you might have been going through to be able to make it into work that day. And especially with blue badge holders, which I have a blue badge. Most people think you're putting it on if you've got a blue badge. You come out of the car and they say, but you can walk properly, so what's your disability? So they have a misconception of what the condition entails. I'd like them to stop attacking me, for example, because lots of people do. They do come up to me and say, why have you got a blue badge? You're not disabled.